Good morning, everyone. My name is Beth, and I'm with the Education Alliance. At the Education Alliance, we work to connect businesses and community partners with public schools across West Virginia. Our goal is to help students discover career possibilities and build skills and confidence they need for life after graduation. And one of the ways that we bring this mission to life is through our virtual work-based learning program, where we give students access to professionals and industries they may not otherwise experience. So today we are partnering with Marshall Health, giving you a behind-the-scenes look at real careers in a real workspace. This session is meant to be interactive, so as the speaker shares their knowledge, I encourage you to write down any questions or thoughts that come to mind, and we can talk about that throughout the session. With that, I'm happy to turn things over to Sarah from Marshall Health.
All right. Good morning, everyone. My name is Sarah James, and I am a recruitment specialist for Marshall Health Network, and I'm super excited to be here today. I do want to first thank the Education Alliance for inviting me here today so that I can have the opportunity to speak with you about healthcare careers with Marshall Health Network and to tell you a little bit about who Marshall Health Network is. So I'd also like to introduce a colleague of mine. Her name is Lindsay Ward, and Lindsay is our MHN School Placement Coordinator. Lindsay, would you like to say a few words about your career at Marshall Health Network?
Yes, absolutely. Like Sarah said, my name is Lindsay Ward. I am the school placement coordinator and educator for Marshall Health Network. I do all the student onboarding for the system for Cabell Huntington Hospital, St. Mary's Medical Center, and Rivers Health in Point Pleasant, West Virginia. I assist with job shadowing opportunities as well, and I'm going to be assisting Sarah answer any questions on this call today.
Awesome. And a little bit of background on myself. Again, I work in human resources, and specifically, I work on recruiting and hiring initiatives across the network, helping to bring great people like yourselves into our healthcare system. I graduated from Marshall University and I've worked in healthcare almost ever since. And so I really enjoy helping people find the right career path, speaking with students like yourselves about careers, and also connecting with our employees and management across our healthcare system, like my awesome colleague, Lindsay. So I'm ready to get started. How about you guys? Okay.
Yeah.
Okay, so should I share my screen now?
Yes.
Okay. All right, just a second here. Okay, how's that look, everyone?
Good.
Okay, thank you for that feedback. Okay, so today we will review who Marshall Health Network is, various career paths you could check out along the way, and we'll also go over the skill set that will be very important to have if you want to work in healthcare, and also some resources that are available to you right now to help you get started exploring healthcare careers. So, before we jump into the careers portion, I want to give you a better understanding of our network. Marshall Health Network is a not for profit academic health system. We serve about 1.4 million people across West Virginia, Southern Ohio, and Eastern Kentucky. This network brings together hospitals, clinics, and physician practices to provide a wide range of medical care, like primary care, specialty services, and behavioral health, all close to home. As part of an academic health system partnered with Marshall University's School of Medicine, Marshall Health Network also supports education and training for future healthcare professionals and contributes to research that helps improve healthcare in our community. Our mission is simple but very powerful: advancing health, inspiring hope, and serving you. Our vision is to be the academic health system that delivers access, excellence, and compassionate care at every stage of life. So together we are, you know the rest, Marshall. So, what is an academic healthcare system and why is it important? Well, MHN, as I will refer to our healthcare network, is a fully integrated academic health system that brings together Marshall Health physician practices, Marshall University, and Marshall Health Network. Marshall Health Network consists of 4 hospitals, so we'll talk about that on our next slide. But together, it focuses on education, patient care, and research. Marshall Health Network has created a single coordinated system where learning, patient care, and research all happen together. And not only does our system treat patients, but also we train students and physician residents to provide high quality medical care and study new treatments to healthcare. So let's take a look at our primary facilities. So on the left, you'll see 4 squares there that include our 4 hospitals in the healthcare system. I'll start with Cabell Huntington Hospital. Cabell is a 303-bed teaching hospital for Marshall University's School of Medicine, Pharmacy, and Nursing. Cabell specializes in advanced surgery, trauma and emergency care, stroke and brain care, burn treatment, maternity services, and orthopedics. And Cabell Huntington Hospital is also home to the second hospital we'll talk about, and that is the Hoops Family Children's Hospital. Hoops is a 72-bed pediatric specialty hospital, also offers a 36-bed level 3 neonatal intensive unit, a 25-bed general peds unit, and a 10-bed pediatric intensive care unit, and a neonatal therapeutic unit. Rivers Health. Has anyone ever been to Point Pleasant, West Virginia, and heard about the Mothman? Well, yes. Well, also in Point Pleasant is Rivers Health, which is a 101 acute bed hospital. Acute care means the hospital is able to provide short-term treatment to patients with serious or short-term illnesses or injuries that need immediate medical attention. And then we have St. Mary's Medical Center, also located in Huntington, along with Cabell, a 413-bed teaching hospital that operates the St. Mary's School of Nursing, Respiratory Care, and Medical Imaging. St. Mary's is the largest medical facility in Huntington and one of the largest in West Virginia. St. Mary's offers advanced care in heart, cancer, emergency, brain, and bone services, making it a leading hospital in the region. Now going over to the right side of the page, Marshall Health. Marshall Health Physician Practices. It is a group of over 1,000 doctors and advanced practice providers who provide care close to home at nearly 130 clinics across the region. Marshall Health is part of the med school. So this is where the doctors and residents who are new doctors in training and nurse practitioners work together to treat people while also teaching medical students. And below Marshall Health, you'll see HIMG. This is the Huntington Internal Medicine Group. It's a large, high-tech medical group in West Virginia that brings many services under one roof. Their medical mall includes doctors, labs, imaging, specialty care, and even a community education center, making it easy for patients to get care without going to multiple locations. And the physician practices, such as the Marshall Health Tays Valley Center and also St. Mary's Ironton, these are examples where patients can go for checkups, ongoing care, and referrals if they need more advanced treatment. The system has urgent care facilities throughout the community that treat minor illnesses and injuries like colds, flu, and small fractures, things that need care quickly but aren't life-threatening. So here's a quick snapshot of the numbers. Marshall Health Network includes 4 full hospitals where patients can get care. Across all facilities and clinics, there are 817 hospital beds available in 119 different places, such as clinics, offices, and hospitals, where patients can receive care. 305 service access points These are the many ways and places patients can connect with healthcare services like clinics, specialty centers, urgent care, and even telehealth options. Basically, lots of spots where people can get help. More than 11,000 employees. This is the total number of people who work for Marshall Health Network. And over 1,000 physicians and advanced practitioners. This means over 1,000 doctors and other healthcare providers diagnose, treat, and care for patients. 116 areas of specialty care, from heart care to cancer treatment to mental health. 28 residency and fellowship programs where new doctors and specialists learn through hands-on experience at Marshall Health Network, and 5 schools of education connected to 5 different schools that train healthcare professionals. Now to highlight our centers of wellness. These are programs that support the health and wellness for patients. Marshall Health Network tries to help people stay healthy, not just fix problems after they happen. They do this by providing care, education, and support in areas like mental health, education, healthy aging, chronic disease management, and access to doctors. So let's look at a few of these. What does this look like for the community? Well, under our Center of Wellness for Addiction and Behavioral Health, this may mean counseling and therapy sessions or support groups for teens and families. Healthy aging may mean exercise and fall prevention programs that are offered to the community. Obesity and diabetes could be education classes and monitoring, group fitness or weight management programs, and rural health and primary care, mobile health clinics in rural areas, telehealth visits for remote patients. So these are ways to outreach to patients who may not live in our direct area of Huntington, but maybe out a little bit where it's not convenient for them to come to the hospital. Check out Marco Mobile Medical Unit that expands rural access to healthcare. This is pretty neat. This is a 38-foot mobile medical unit that includes 2 fully equipped exam rooms, a blood draw area, telehealth capabilities, and a waiting area, and even a restroom. So Marco is a big fan. He will travel throughout Marshall Health Network's 40 county service area to provide care tailored to the unique health needs of each community it visits. So you may think, why do we need a Marco mobile medical unit? Well, kind of what I just mentioned. It's to fill in the gaps in care. Access to care is one of the greatest challenges in rural health. This can address transportation barriers and bring care directly where it's needed. MHN also offers telehealth services. Telehealth is when you see a doctor or nurse online through a video, phone, or an app instead of going to their office. Both of these options help people who live far away from a clinic, who may have mobility issues or chronic conditions, or people with tight schedules such as schoolwork or caregiving, which is really great for the telehealth option. Okay, this is a map to help us understand our service areas. So first are the primary service area. This is the bright green area for the counties. This is where most of our patients live and receive care. Then you'll see the secondary service areas. This is the counties in yellow. These are nearby regions where people come to us for specialized care or less frequent care. And then we have, let's see, the tertiary service area. This is the farthest reaching area. So these patients travel to us for highly specialized or advanced medical treatments not available locally. So you can see that we do serve patients in Ohio, Virginia, and Kentucky, as well as West Virginia. So I'm proud to share that Cabell Huntington Hospital has earned a spot on the Health Grade America's 50 Best Hospitals for 2026, recognized for exceptional care and patient outcomes. Cabell is the first and only hospital in West Virginia to earn this distinction. This means that this places Cabell Huntington Hospital among the top 1% of hospitals nationwide and reflects its unwavering commitment to exceptional patient care. Well, I could also brag for days about our network. St. Mary's Medical Center recently celebrated 20,000 life-saving open heart procedures. St. Mary's is home of the Regional Heart Institute and is the Tri-State's leader in cardiac care. Then Marshall Health physician practices, they are on the cutting edge of medicine. Our academic medical team and growing research enterprise are driving breakthroughs in cancer, liver disease, and pneumonia, and are making a global impact. At the same time, our researchers tackle challenges that matter most to Appalachia, such as irritable bowel syndrome, obesity, and addiction. You can even get involved. You could ask your physician about Marshall University research studies and help advance medicine for your community and beyond. So you could participate in a study. This is the St. Mary's Medical Center for Education. It is a shining star in the tri-state region and in the world of healthcare education. This is a state-of-the-art facility that provides quality education to healthcare professionals and students in the area in the fields of nursing, medical imaging, and respiratory care. This center supports the St. Mary's School of Nursing, for example. This is an Associates of Nursing program that is provided through a partnership between the St. Mary's School of Nursing and Marshall University. The length of the program is 2 academic years, and the degree awarded is an Associate of Science from Marshall University. So students can choose to earn a bachelor's degree in medical imaging or sonography or even respiratory care and take classes on and receive hands-on training in this state-of-the-art facility. Okay, do we have any questions so far? Because the next part of our presentation will be on careers.
No, we're good.
Okay. Well, welcome to the next part of the session. We're talking about careers, which is one of my favorite topics. There are so many careers in healthcare that it can be difficult to know where to start or what your best career path may be. The first step in any career journey is figuring out what you like and what you're good at. Do you enjoy helping people? Working with computers? Solving problems? How about being creative? There's a role in healthcare for every interest. Think about your favorite subjects in school or activities that you enjoy. Raise your hand if you like science. Does anybody like computers out there? Who likes helping people? Or being creative? Or even if you enjoy working in a teamwork environment? Just like any journey, there are steps along the way. Some jobs need training or school, some need certificates, and some are leadership positions that you can grow into. Let's take a look at some different healthcare pathways. Remember, though, it begins with what you enjoy and where your skills lie. So when you think of healthcare, you probably imagine doctors and nurses, and those roles are super important, but there is so much more behind the scenes that happens in healthcare. So there are the clinical and patient care roles, but there's also roles that are a little bit behind the scenes, like those in the laboratory. And hospitals and healthcare systems do need lots of different jobs to help patients get the best care. Some people work directly with patients, and others work with data and technology to make sure everything runs safely and efficiently. Some focus on operations like managing supplies and staff, and some work in strategy and communications, helping the community learn about programs or making big decisions for the system. Today, I'll walk you through examples of both clinical and non-clinical careers, yet still healthcare related. to help you explore which direction might interest you both or you most. Before we move on, let me ask you this. Which types of jobs, just based off this screen, do you think might be interesting to you? You don't have to pick, but think about what fits your skills and hobbies. So let's start with one of the most well-known healthcare careers, nursing. Nurses are the people who spend the most time with patients. They check vital signs, they give medications, and make sure patients are comfortable and recovering. Nurses can work in a lot of different places like hospitals, clinics, schools, and even on helicopters or travel teams. To become a registered nurse, you go to a college or school for a nursing degree and pass a licensing exam. The great thing about nursing is that there are so many ways to grow. You can specialize in areas like pediatrics, emergency care, or even become a nurse leader. Raise your hand if you've ever had a nurse help take care of you, or even take care of a loved one. You might be surprised to learn that we actually need more nurses across the country. Experts estimate that by the year 2030 that the United States could be short more than 60,000 nurses. Many states are already experiencing shortages and have been, including West Virginia, which means hospitals and clinics are always looking for people interested in nursing careers. Let's also spotlight radiology. Radiology professionals are like detectives. They use advanced medical imaging technology to help doctors figure out what's going on inside a patient's body. If you enjoy technology, working with patients, and problem solving, radiology could be a great career path. There are also many types of imaging that you could specialize in, like X-ray, CT scan, MRI, or ultrasound. And here is another fun fact. Rad techs can perform dozens of imaging procedures each day, helping doctors see inside the human body without surgery. And similar to nursing, rad techs are very much in demand. What does that mean for you? Well, there's a high probability of having no problem finding a job after school. Let's next highlight medical laboratory scientist. Have you ever thought about becoming a scientist? Well, it is totally possible. There's an easy route. I shouldn't say easy. There's a route you can go to become a laboratory scientist. You don't have to go to school for millions of years to be one either. So, medical lab scientists, they work behind the scenes and they play a huge role in healthcare. When a doctor orders blood work or other tests, lab scientists analyze those samples using specialized equipment like a microscope. Their results help doctors diagnose illnesses, track infections, and determine the best treatment for patients. So, medical lab scientists, they do not work directly with patients. So, if you're someone who doesn't think you would enjoy that patient care front-facing interaction, this might be a great career to consider. And actually, medical lab scientists, they diagnose a disease in a patient before the doctor even does. So they see it first and then pass that information on to the doctor. So you can achieve this by receiving a bachelor's degree in medical laboratory science or a related field. And there's many schools locally that offer this.
I have a question, if you don't mind,
Yeah.
about the medical lab. Are they always located within the hospital or are they off the hospital campus? What kind of locations use the laboratory scientist?
Well, they can work in off-site labs, but typically they work in the hospital. So they're a part of the hospital internal system and they're located right here with everyone else in the main hospital in the lab.
Thank you.
And about 70% of medical decisions are based on those lab test results. So it's a very important job. Let's next talk about information systems, or IT. It's information systems at Marshall Health Network. So technology obviously plays a huge role in healthcare today. Hospitals use computer systems to store patient records, schedule appointments, run lab tests, and communicate between departments. Information technology professionals make sure all of these systems work properly and stay secure. They help protect sensitive patient information and solve computer programs or computer problems for doctors and nurses. If you enjoy working with computers, solving technology problems, or learning about cybersecurity, healthcare information systems could be a great career path. So there's lots of different jobs within IT. You could be an IT specialist, work on general computer programs. You could specialize in cybersecurity. You could be a healthcare systems engineer and actually build programs that healthcare professionals will use. So how many of you enjoy working with computers or technology? If you do, that's awesome because healthcare needs people with these skills. And instead of a fun fact, here's a scary fact. Healthcare is one of the most targeted industries for cyber attacks, which is why hospitals need cybersecurity experts. Our next career spotlight is marketing and communications. So healthcare organizations also need people who are creative and good at communication. These are the individuals who work for the system who help tell the hospital story. They create social media posts, advertisements, and community campaigns to help people learn about the important health programs and services. If you enjoy creativity, writing, design, or social media, marketing can be a great career. And you may seek a degree in actual marketing. There's also degrees you could earn in communications, public relations, or business. Here are a few examples of some different marketing campaigns from our health system. So these are materials that were designed to help communicate a community wellness event that you'll see on the left there. It helps keep the public informed and engaged in our program and services. And also, I worked with marketing and they created a flyer that I use when I go to job fairs or speak to students that helps highlight opportunities, in this example, for new graduate nurses and other potential applicants so that they can see how to apply for positions, showcase our workplace culture, and outline the benefits and opportunities we offer. So their work provides an important role in both community outreach and attracting top talent to our organization. So then there's the operations and support careers side of everything. So these are also behind the scenes professionals. Operations and support careers are the backbone of healthcare. While doctors and nurses care for patients directly, professionals in supply chain, finance, and human resources make sure everything runs smoothly behind the scenes. So think of it this way. The supply chain. These individuals make sure hospitals have the right equipment and supplies. Finance ensures that resources are managed so care stays available and affordable. And human resources hires and supports the people who deliver the care.
Very senior and environment, please report to Ms. McAtee's room at this time. And then senior biomed students report to the senior.
Imagine a hospital without one of these. No supplies, no staff, no budget. What do you think would happen? It could definitely throw off a lot in healthcare and make patient care unmanageable. And you can obtain a degree in business, finance, human resources, or healthcare administration. There are a lot of options. Think of the hospital like a sports team. The patient is at the center, and all of these careers work together to make sure the patient gets the best care. So now let's talk about skills that everyone needs if you would like to succeed in healthcare. So whether you're working in a patient care room or in an office setting, certain skills are essential for anyone in healthcare, regardless of their role. The next few slides will focus on these key skills. So let me ask you, before we dive into it, what do you think is the most important skill for someone working in healthcare?
Management.
Communication.
That's a great one. Yep.
Time management.
Oh, yep. Great. Great. Yes. Well, let's go into some of these skills. I can hear definitely certain words jumping out, and you're right on track. So the first one is communication. So pat on the back for the students or teachers that suggested that one. Communication is important so that we're able to listen carefully, explain things clearly, and interact respectfully with patients, families, and our coworkers. So that's at the top of the list. Teamwork, collaboration. Healthcare is never done alone. Everyone from nurses, the dietary staff, works as a part of a team with shared goals. Problem solving, critical thinking. Healthcare involves unexpected situations. Being able to think through a problem and act appropriately is important. How about this one? Empathy and compassion. This is huge. Even if you have all the other skills, but you don't have empathy, that would make it difficult to have a career in healthcare. We need to be able to understand and care about what others are going through. Patients are often nervous or scared, so showing kindness matters. Reliability, responsibility, showing up on time, following through on tasks, and being dependable. People depend on you to do your part so that the whole team can succeed. Attention to detail. Small mistakes can have big consequences in healthcare. So, for example, you may need to double check a patient's info or follow up on a process carefully, even if your role isn't clinical. Adaptability, flexibility. Healthcare environments can be fast-paced and unpredictable. You must be able to adjust to change, such as shifts or tasks may change, and you have to handle it professionally. Okay, healthcare skills lightning round. How about we put these skills to the test? I'll read a scenario, and if you could raise your hand to answer verbally, tell us which skills you would use and how. So what we will do is identify the issue, decide what to do to fix the issue, and highlight what skills were applied of the 7 skills we just learned about. And let me see if I can pull up my Zoom so that I can see you guys. Okay, do you still see my screen or do you see my Zoom screen?
Still see your screen.
Okay, good. Okay. Okay, so here's our first scenario. You noticed a patient's form is missing information. Who do you tell and how do you communicate it? So let's first identify the issue. There's important patient info that's missing. Okay. Who would you inform that the patient's info is missing? Okay, I see a student.
Hi, front desk.
Great.
They said there.
Yes, you could definitely notify the front desk. You could also notify your supervisor, or if the patient's there with you, you could let them fill in the missing information. And then your next step would be, so what are you doing whenever you talk to the patient or the front desk and you say, hey, just want to let you know there is some missing information? What skill are you using?
Communication.
Communication.
Great job.
Yeah, teamwork.
So the skills highlighted here are communication, you explain the issue, attention to detail. So you caught the missing information before it caused a problem. And teamwork. You involve the right person to help fix the issue rather than trying to handle it alone. Okay, here's our next scenario. 2 volunteers are scheduled for the same shift, and you're in charge of doing all of the scheduling for the volunteers, but you only need 1 person for that shift. So how would you handle that? Again, you all have already highlighted that communication is really important. And again, in this scenario, it's also important. You could say politely, I noticed you're both scheduled at the same time. Could one of you adjust your shift so that we can cover everyone's responsibilities? You could also offer solutions. You could say you two could swap shifts, you could divide the duties, or you can check with your supervisor. And you want to keep the team informed so that everyone knows about the resolution. So the skills highlighted were communication, probably no surprises there, teamwork, work with the volunteers to solve the issue collaboratively, and adaptability, adjust plans to accommodate both volunteers. Okay, let's take a look at this one. A patient comes to the front desk looking confused about where to go for their appointment. They seem nervous and unsure. What would you do? Yes,
Well, one of the communications, I guess, would be empathy.
yes,
So you would reassure her that everything's okay and guide her to where she's supposed to go.
yes, absolutely. You're putting yourself in that patient's shoes and imagining what they may be feeling. So that's a great answer. Let's see what skills. Empathy, recognizing the patient's feelings and offering reassurance. Communication, you can explain the directions clearly and politely, and even teamwork comes into play. Maybe you're not sure where a certain, office is located or where they need to go, but you could always ask someone else who works at the hospital or the location where you are. Okay. How about this one? Important supplies are missing for a shift. What would you do? So you recognize that supplies are missing that could disrupt the workflow and affect patients or team efficiency. You understand that this is a problem and it needs a quick action.
Talk to the front desk or the person that's supposed to go get it.
Great job. Yes.
Yeah, everyone's supposed to go too.
Yes, notify the right person. You could let your supervisor, the team lead, the front desk, someone who would be responsible know immediately. You could also check for alternatives to see if there's backup supplies, and you can keep the team informed to let them know this is missing and what adjustments are needed. So again, our skills highlighted here, the big one for this scenario, problem solving, figuring out a solution when supplies are missing, and using teamwork to collaborate with the team to adjust to keep things running smoothly.
To the office to sign out.
So great job. You already have many of the skills needed to succeed in healthcare. And the good news is you can continue to build and develop through programs and classes like the class you're in today. Job shadowing and real world experience will help you expand on this skill set. So now let's look at ways you can explore healthcare careers and resources available to help you. MHN is proud to partner with the Education Alliance and Wayne High School and Capital Midland High School to offer the MedEx program. So this is a 2-year program where your junior year, you're mainly in the classroom learning about healthcare careers and also doing some job shadowing at local hospitals. And then your senior year, you actually get to be paid and participate in the staff at the hospital working in certain roles, learning the clinical day to day. So you're stepping into that patient care role and you're getting hands-on experience. So you get to see what it's really like to work in a hospital or healthcare setting. And just to note, if you did happen to miss this opportunity or not a part of it, don't worry because you can still job shadow, and we'll talk a little bit more about that. So through the MedEx program, you can learn about becoming a patient care tech or a medical assistant and actually graduate with the skills and access to the certification to become certified in one of these areas and immediately obtain a job right out of high school. So this is a great opportunity. But there's also job shadowing available to you. And Lindsay manages this program so well and is so helpful to students who are interested in job shadowing. It's open to high school students and college students. You can follow this QR code to fill out an application, but you can job shadow in, most healthcare settings, the laboratory, business setting, or other areas you may be interested in. And I'd like to tell you a little bit about the Aspire Tuition Assistance Program. I want to make sure you know that we offer this program. Marshall Health Network is dedicated to fostering career growth and development within the healthcare field by providing employees with advancement opportunities and offering financial assistance to students pursuing careers in healthcare. So you do not have to be currently employed with Marshall Health Network to receive tuition assistance. So if you go to a college, university, or a training program in our region, you can receive up to $20,000 in tuition assistance. It's paid directly to the school. So programs in nursing like LPN, RN, rad tech, surgical tech, lab tech, and there's some other high demand careers that would qualify. And in exchange for the tuition assistance, you would agree to work full time at MHN after graduation for either 3 or 5 years. So this helps students afford school, and it also builds a strong healthcare workforce in our region. And so we have employees who go through this program and receive the tuition assistance while they're working, and also students can apply for this program as well. And there is more information on our tuition assistance program on marshallhealthnetwork.org. And if you go to the Find a Job tab, and then you'll see another tab called Aspire.
So I think that's all the time we have today. That's the
Okay.
end of their class time. Thank you
Okay.
so much for all the valuable information. Students, if you guys have any questions at all, have your teacher reach out to me, or we have Sarah's information right there. You can send her an email. All the information's there, and she can follow up with you. So thank you
Thank
so much
you.
for being here today.
Yeah,
Thank you
it's
for
my pleasure.
presenting. Yes, and I hope you have a great week. Thank you guys.
Thank you, Beth.
Thank you.
Bye.
Thank you.